From Havana, I am Luis Carlos Silva, the Cuban local representative of the International Association of Survey Statisticians, and I thank the association, and in particular thank Denise Brits do Nascimento Silva for the invitation and for the support received that make possible the presence of my contribution today. Is about the national study of seroprevalence and prevalence of COVID-19 in Cuba. Although statistics on confirmed cases and deaths can help with monitoring the dynamics of disease propagation, they are not ideal when trying to estimate the proportion of the population infected, which is an important measure for public health decision-making and the ongoing COVID-19 pandemic. Generally, mildly affected or asymptomatic individuals are not screened. As a result of that, the number of confirmed infections is largely underestimated. In this context, seroprevalence surveys are of utmost importance to assess the proportion of the population that has already developed antibodies against the virus and might potentially be protected against subsequent infection. Of the present year, Maria van Kerkhoff, who is the technical lead of the WHO Health Emergency Programs, explained the importance of population-based seroepidemiological investigations using representative samples to understand the COVID-19 epidemic. They have suggested three possibilities. One of them is one cross-sectional study. The second one is successive cross-sectional studies with different samples. And the last one is to make a cohort study like ours. Ours is a prospective study based in the construction of a cohort coming from a representative national sample, which will be followed in time along 3 months. This is the most refined alternative of the one suggested by the was a national representative sample comprised 3 stages: municipalities, basic health units, households, and finally all the persons in the household were included in the sample. And we have 4 waves. The first one was already done, and presently we are in the second one. The study is aimed at obtaining precise estimates of the immunological status of the population, at monitoring the evolution of the epidemic, and identifying the most significant risk factors for infection. This study took advantage of the nature of our primary health system. Cuba is a nation of 11 million people with a universal public health system, with no private health services of any kind, with basic health units, also known as family doctor and nurse offices, located in every neighborhood across the country. That means that family doctor and nurse model is extended throughout Cuba, reaching the most remote areas until finally reaching the whole population. You can see here the structure of the sample after selected some basic health units through municipalities. We got some dwellings, selected some dwellings, and finally all persons living in the household were included in the sample. Here you have a map with the municipalities involved in the study. Some pictures taken a couple of days ago, and they are expressive of the kind of work we are dealing with. At the present time, there are only 2 countries following the WHO suggestion. They are Spain and Cuba. And there is another one announcing the development of similar study in some days or weeks, which is Portugal. I will please take note of the huge difference concerning non-response. Our almost total acceptance is basically due to the confidence of the Cuban population in the Ministry of Public Health and to the capacity of our family doctor and nurse offices to get people collaboration. That you can see here are very expressive, obviously. I want to share finally a technical detail about the sample. When we are dealing with a large population and we have a complex probabilistic design, it is usual to make a basic validation to corroborate the correctness of the given probabilities. When adding the weighting of all the members of the sample, we can corroborate that the result is close to the size of the population, with an error no larger than 3%, for instance. In our case, we had a very pleasant result. As you can see, the sum of the weights is 98% of the Cuban population. I hope you will be kind enough to forgive me for my terrible pronunciation in English. And in any case, you have here some information to contact me if you want. Thank you very much from Havana.